There's a wide range of things that artificial intelligence could be applied to in cancer care. I think we're seeing these like across all of medicine. My group works primarily in the electronic health record space. So, we collect a lot of sort of routinely collected data. That data has its own challenges because they're sort of biased for a number of different reasons. And so, our focus is trying to work through that data and understand how it can be useful. Those things can be used for a lot of different ways to try to improve care delivery. So we largely focus on trying to like use information from that to try to direct people to the right place, try to improve sort of early referrals. Early symptom identification, things like that. So that's one piece of the puzzle, sort of trying to parse out sort of the routinely collected data that we gather during clinical visits. There's a lot of interest, I guess, like as when we're talking about AI in clinical care. I think the two things that have been sort of very heavily investigated over the past few years, in addition to that, I'd say electronic health records, but in addition to that are applications of computer vision. So radiology, so imaging, so like X-rays, CT scans, MRIs, things like that, as well as pathology images. So when any kind of in cancer care specifically, it's largely consists of things like biopsies or surgical specimens. Those things are often sort of reviewed by both images and pathology slides are reviewed by like an expert physician in those areas, either a radiologist or a pathologist, and trying to find ways to sort of either support them in what they do or to find signals that correlate with things that we can anticipate. For instance, like with screening or understanding if there are certain types of characteristics that are correlated with outcomes or response, trying to use computational approaches to tease those things out, I think is a big potential application of AI as well. There are probably, I'd say that there are also a number of avenues in like trying to just improve like efficiency in the clinic. One of the major issues these days is physician burnout, and oncology is no different. So leveraging computational tools to basically make the clinic work more efficiently, more effectively, avoid delays in care, support clinicians in sort of the day-to-day tasks. I think there's a lot of sort of, I'd say low-hanging fruit, but low-hanging opportunities to make like cancer care delivery just more efficient, better for patients, better for the clinic as well. So those are at least a few examples off the top of my head.